heart failure occurs when the heart is unable to pump sufficient blood for the body's needs. This condition is not only chronic but also a very serious condition. Fortunately, with medical innovations, there is hope for recovery.
For aortic valve replacement is usually in a patient who is a bit of the older age group where the valve is fused and they got this condition called aortic valve stenosis. Aortic valve stenosis will lead to a very high pressure in the left ventricle and it causes heart failure and chest pain and even fainting spells if the aortic valve is very, very tight. So this group of patients will benefit from aortic valve replacement. So this valve is what we call an aortic valve, where we can remove the damaged aortic valve and replace it with an animal tissue valve. The advantages of an animal tissue valve is that you don't have to take blood thinner. So tissue valve is recommended for patients who are above 60 years old and wants an active lifestyle. This valve will give you back that kind of active lifestyle. This is an animal tissue valve placed in a mitral position. Patients who receive a tissue valve does not need to take a lot of anticoagulant or blood thinners, and this will resolve your mitral valve problems. So in mitral valve disease, you can have mitral valve that is very narrow called mitral stenosis, or the valve is leaking a lot called mitral regurgitation. In mitral regurgitation, in today's context, most cardiac surgeons will try to repair the valve because this will allow the patient to have his own valve and without taking any blood thinner or anticoagulation. But if the patient has advanced disease and the valve is very much damaged, then we will replace the valve with an animal tissue valve, and this also will not require any anticoagulation.
There are many ways to heal and strengthen a weak heart. However, there are bound to be situations whereby patients are in need of a heart transplant. The question now is, how does one survive a failing heart while waiting for a heart replacement? Well, our professionals have the answer.
如果在做这些手术后，病人的心脏还是非常弱的话，这些我们可能需要给他一些其他的治疗法，当然包括电池，那些可能忽然猝死的病人，我们给他需要移装那个电池能这样除颤剂。那一些病人到严重心脏衰弱，就是第3、第4期心脏衰弱，走一点路都会喘的病人，什么方法都已经用过，他还是非常弱，可是他还非常年轻，我们可能考虑说用心脏移植的治疗法。可是心脏移植在现在这个社会，其实我们捐器官的人口有限，在这个考量下，我们才考虑到说装置一些人工心脏，所谓简称就是人工心脏，但其实医药名称是我们所谓的左心室辅助装置，英文是 LVAD。
Now, some patients, maybe in 10% of patients, some of the hearts may recover, and if the hearts recover, we can remove that pump. And the other group of patients, the majority, will either wear the pump in the long term or be transplanted in a country where they allow transplantation. So they can wear the pump in 3 ways. 1 is to bridge to recovery, 2 is to bridge to a transplant, and 3 is to wear the pump in the long term.
在新加坡，我们人口捐赠即使是有那个条例，可是我们一年最多可能只有4、5个心脏移植的手术，所以可是缺这些需要的人更多，所以我们才会有这个治疗法。在邻国，他们是因为回教的国家，所以他们并没有一个心脏移植的项目，在他们国家也没有这方面的设备，而且他们经验也不足。如果他做的经验少的话，其实他的那个并发症 complication 会比较高。所以我们还是建议他们为什么会来新加坡，首选来新加坡，是因为我们在这方面的经验比较充足。
Thank you for watching this episode on the heart. If you have any medical queries, please feel free to contact us and we'll be sure to assist you in a heartbeat.